I'm joined by Dr. Jenny Harries, the Chief Executive of the UK Health Security Agency, and by Professor Steve Powis, the Medical Director of NHS England. We've always known that the winter months would pose the greatest threat to our road to recovery. The darker skies, the colder weather provide perfect conditions, not just for COVID-19 to thrive, but for other seasonal viruses too, like flu and norovirus. And ahead of winter, just as we expected, we're starting to see this impact. Cases are rising, and yesterday we reported 43,738 new cases across the UK, up 16% from the previous week. And they could go yet as high as 100,000 a day. We're also seeing greater pressure on the NHS. Across the UK, we're now approaching 1,000 hospitalisations per day. The NHS is performing with distinction, and I'd like to thank everyone who's working so hard to keep us safe. And we'll do what it takes to make sure that this pressure doesn't become unsustainable and that we don't allow the NHS to become overwhelmed. Deaths remain mercifully low, but they are still, sadly, over 100 a day. This pandemic is not over. Thanks to the vaccination programme, yes, the link between cases and hospitalisations and deaths has significantly weakened, but it's not broken. So we must all remember that this virus will be with us for the long term and that it remains a threat to our loved ones, and a threat to the progress that we've made in getting our nation closer to normal life. We're looking closely at the data, and we won't be implementing our Plan B of contingency measures at this point. But we'll be staying vigilant, preparing for all eventualities, while strengthening our vital defences that can help us fight back against this virus.